Welcome to lesson 3. This is where everything is really starting to come together in a more complete and practical way. So up until this point, we've talked about addiction as a disease, and we've kind of explored what's happening in the brain from really a neurological standpoint. But if we stop there, we're still missing a really big part of the picture. Because addiction is not just caused by one thing. It's not just all about the brain, and it's not just all about behavior. It's a result of multiple factors that are interacting over time. And that's where the biopsychosocial model is coming in. This model helps us understand addiction in a more complete and a realistic way. And it's going to help us avoid making assumptions or oversimplifying what our clients are experiencing. So as counselors, we need to be able to look at the whole person, not just one piece of their story. So I want you to think about your clients as we go through this lesson and think about the different factors that may be influencing some of their behaviors. Some of these factors might be obvious and some of them may not be. So this lesson is going to help you to identify and organize those factors in a way that's improving your clinical work. And it's also going to help you communicate more effectively with clients and with their families and other professionals. Because the more that you understand this whole biopsychosocial model, the more confident that you're going to feel in your assessments and your treatment planning. So stay engaged, take your time, and really think about how this applies to you in your real world work. So let's just take a moment and talk about what you should walk away with after you complete this lesson. So first, you need to have a clear understanding of what the biopsychosocial model actually is, not just the definition, but how it's working in practice. And then second, you need to be able to identify the different types of factors that contribute to addiction. These might be biological factors like maybe genetics or brain chemistry. Or maybe there's some psychological factors like thoughts and emotions. And then we also have social factors like the client's environment and their relationships. And then third and most importantly, you should be able to apply this model in your clinical work. This means using it to guide your assessments and your treatment planning, and also what your interventions are going to be. And I want you to pay attention to how this model changes the way that we think about the client. It should move you away from a narrow view and toward a more comprehensive understanding. So as we're going through this lesson, I want you to ask yourself, what am I missing when I only look at one part of the problem? And that question is going to help you stay focused on the bigger picture. This is not just about learning new information. It's about changing the way that you approach your work. And that shift is going to make a really significant difference in your effectiveness as a counselor. So the biopsychosocial model, this is just a framework that helps us understand addiction as the result of multiple interacting factors rather than just a single cause. And that's important because people often look for one explanation. They may say, oh, it's genetic, or oh, it's because of trauma, or it's because of their environment. And yes, each of those factors can be true, but none of them alone fully explains addiction. So this model is recognizing that these factors work together and they're influencing each other. So for example here, a person may have a genetic vulnerability, but whether that vulnerability leads to addiction can really depend on the person's environment and what their coping skills are. And then similarly, someone may experience trauma, but their response to that trauma can be influenced by their biology and their support system. And that interaction is what's making the addiction complex. And it's also what's making treatment very challenging. So as counselors, we need to be able to hold that complexity without becoming overwhelmed by it. So the biopsychosocial model is just giving us a structure for doing that. It's helping us organize the information and make sense of what we're seeing. And it also helps us avoid blaming the client or reducing their experience to just one factor. Instead, we need to look at the whole picture and develop a more balanced understanding. And that understanding is going to lead to better care. So This model, it matters more than you might realize at first. One of the biggest problems in addiction treatment is the oversimplification of it. When we oversimplify, we're tending to focus on just one area and we're ignoring the others. I'm constantly telling my clients, you have to look at the whole coin. You can't just look at one side of it. So, for example, if we as clinicians, if we're only focusing on behavior, then we might miss any underlying trauma, or maybe we might miss some mental health issues. And if we focus only on biology, we might miss some environmental stressors or relationship dynamics that are going on. So this biopsychosocial model is helping to prevent that by encouraging a more comprehensive approach. And this is really just going to lead to better treatment outcomes because we, the clinician, we are addressing multiple aspects of the problem. And it's also going to build empathy. When we're understanding that a client's behavior is influenced by a combination of factors, it becomes a little harder to judge them. So instead of asking, why are they doing this? We start asking, what is contributing to this? And that shift in thinking is really critical. It's going to change how we're interacting with our clients and how we're responding to challenges, and also how we're approaching the treatment. It's going to help us communicate a little bit more effectively with other people that are involved in the client's care. Whether we're talking to a family member or a probation officer or another clinician, this model is giving you a way to explain addiction in a more complete and accurate way, and that is a really valuable skill to have. So at the core of this model are three main components. We have biological, psychological, and social. So biopsychosocial. And each of these represent a different set of influences on a person's behavior. So the biological factors are things like genetics, brain chemistry, what their physical health is. And then psychological factors are going to be the thoughts, the emotions, the beliefs, what their coping skills are. And then the social factors are going to be, what is this client's environment? How are their relationships? Who are their relationships with? What culture are they from? Do they have access to resources? A lot of times when I'm doing a biopsychosocial assessment, I'm trying to find out, do you have a driver's license? Do you have reliable transportation? Do you have health insurance? When's the last time you went to the doctor? When's the last time you went to the dentist? Do you have access to that kind of stuff? These components, the bio, the psycho, and the social, they're not separate boxes. They're all interconnected. And so changes in one area are going to affect the others. So, like, for example, if somebody has chronic stress from a difficult environment, that's going to impact their mental health. And that can in turn affect their brain chemistry. And so this interconnectedness is what's making the model so useful. It's reminding us that we can't treat one area in isolation. We need to consider how all of these factors are interacting. So as you're thinking about your clients, you need to try to identify some examples from each of those categories for your clients. What kind of biological factors are present? What are the psychological factors that are present? What are the social factors that are present? So this exercise is going to help you start using this model in a very practical way, if you can start doing that with each of your clients. So let's jump back into the biological. These factors are often the first thing that people think about when they hear the word disease, because they are an important part of the picture. So these factors are going to be genetics, brain chemistry, family history, things like that. And the research has shown that genetics can increase a person's risk for developing a substance use disorder. That doesn't mean that addiction is guaranteed, but it does mean that some people are a little bit more vulnerable. The research out there says that if you have a parent that's addicted to something, then you are 50% more likely to develop an addiction. If you have a grandparent who has an addiction, then you're 25% more likely to develop an addiction. So there is some genetic component to it. It's not one specific gene, but there is genetics and telomeres and connections and things like that. They're passed down. Brain chemistry is also another factor. As I talked about in the previous lesson, substances can alter the brain's reward system, and it's going to affect motivation and the client's behavior. And so those changes are going to make it a little bit more difficult for the person to stop using, even when they want to. And the family history also plays a really important role in that, both genetically and environmentally. Growing up in a household where substance use is present, that's going to influence the person's behavior because they're going to see it as, oh, this is what everybody does. And it's going to increase their exposure to it. So as counselors, we have, it's important for us to recognize what these factors are without using them as an excuse for the client's behavior. Instead, we just want to look at it as part of our understanding. And that's going to help us see why some clients may struggle more than others. It's going to help us tailor our approach. So, for example, a client with a strong family history may need more support and monitoring. So when we understand that biological factor, it's going to help us provide more informed and compassionate care to the client. Genetic vulnerability, this is a concept that really often gets misunderstood. So I want to take a little bit of time to clarify it. When we say that someone has a genetic predisposition to addiction, we're not saying that addiction is inevitable. What we're saying is that their risk is higher compared to someone without that predisposition. It's similar to other health conditions. So, for example, somebody with a family history of diabetes may be at higher risk, but that doesn't necessarily guarantee that they're going to develop diabetes. The same principle applies here with addiction. The genetics are going to interact with the other factors like the environment and their behavior. And this is why we call it addiction is a lifestyle disease, right? Your lifestyle led to the disease, but once you have it, you can't get rid of it. And it's really important to communicate all of this to the clients. Some clients get really discouraged when they learn about the genetic risk, and they just think, oh, it's in my DNA. There's nothing I can do about it. But it's important to correct that thinking. Genetics influence the risk. They don't determine the outcome. And the clients do have the ability to make those changes and improve their situation. Personally, both my parents were addicts, and I did not go into that. So as counselors, we want to provide information in a way that empowers rather than discourages the client. So that means that we have to be clear, we have to be accurate, and we have to be supportive in how we're explaining these concepts. Brain chemistry is another critical piece of the biological component. Neurotransmitters are chemicals in the brain that help transmit signals between the neurons. And dopamine is one of the most well-known neurotransmitters involved in addiction because of its role in the reward system. So when substances are used, they're going to create an increase in dopamine levels in a way that's reinforcing that behavior. The brain starts to see it as necessary for survival, and then it kind of pushes everything over to the side and sees this as the most critical thing for survival, and so they're going to be pushed towards doing that. And over time, that creates an imbalance. The brain begins to rely on the substance to maintain that normal functioning, and that can lead to changes in the mood or motivation or their behavior. And it also makes those natural rewards a lot less satisfying. And that's why clients lose interest in activities that they once enjoyed. And understanding this helps us see that addiction's not just about seeking pleasure. It's also about avoiding discomfort and maintaining a sense of normalcy. So as counselors, we can use this information to educate our clients and help them understand what they're experiencing. That really reduces the confusion and it increases engagement in treatment. Physical dependence, this happens when the body adapts to the presence of the substance and it starts to rely on it to function normally. So when the substance is removed, the withdrawal symptoms start to happen. And these symptoms can be really uncomfortable. And in some cases, it can even be dangerous. I know like alcohol and benzodiazepines, those are life-threatening situations in withdrawal. And this is a really important aspect of addiction because it's It's highlighting the physical component of the disease. It's not just about behavior or a person's mindset. The body itself has changed. And this makes it really difficult for people to stop using without support. So, as counselors, it's important to recognize the role of physical dependence and to work collaboratively with medical professionals when that's necessary. And it's also important to educate clients about what to expect. So, when clients understand that withdrawal is a normal part of the process, they may be a little bit more prepared to handle it. And that can improve retention and it's going to improve the client outcome. Another thing that we have to look at is medical conditions, because these play a really significant role in substance use. People with chronic pain might use substances to manage their symptoms. And then also people with co-occurring mental health disorders may use substances to cope with emotional distress. This is what we call self-medication. And it does provide temporary relief, but it really leads to long-term problems. And this highlights the importance of integrated treatment. We can't treat substance use in isolation from other medical or mental health conditions. So as counselors, we need to be aware of these factors and coordinate the care when necessary. And that might mean working with doctors or psychiatrists or other professionals. Really, the goal here is to address the full range of the client's needs. And when we do that, we increase the likelihood of a successful outcome. I do want to stop here and talk about self-medication for a second. I wrote a book about how ADHD and addiction correlate with each other. And when I was doing the research on this, I found a very interesting research study that was done on people with ADHD who take their medications as prescribed. They are less likely to develop an addiction to street drugs, which is kind of mind-blowing because every time I bring up the topic of self-medicating with ADHD, a lot of the clients, they will stop and they will say, well, I was on my medications, but I ended up on street drugs. And I always have to stop them and ask them the question, when did you stop taking the medication and when did you start taking the street drugs? And a lot of times what they realize as they're saying it is that after they stopped taking the medication, it's not very long after, probably within a year or two, that they start using street drugs to self-medicate. And then they start to see the correlation of, oh, I stopped using the medication. So as long as the client is medicated properly on the proper medication, then they should not find themselves using street drugs to self-medicate. So before we transition into the psychological component, let's pause and bring the biological factors together in a way that's practical for your work. So the biological factors don't exist in isolation. They're interacting with the psychological and the social influences. And that interaction is what's shaping behavior. So a person may have a genetic vulnerability, but whether that vulnerability is leading to addiction is depending on other factors. And this is important because it's preventing us from thinking in extremes. It's not helpful to say, oh, it's all genetics. Just like it's not helpful for us to say, oh, it's all a choice. The truth is kind of somewhere in between all of that. And it's influenced by multiple variables. Another important point here is that the brain can heal. And that's something that we definitely need to emphasize with our clients. A lot of people feel hopeless when they learn about the biological aspects of addiction. They think that the damage is permanent. We all saw those, this is your brain on drugs commercials, and it made it just look like we fried our brain permanently. So we really have to correct that misconception. The brain has this ability to adapt and recover over time, especially with consistent support and healthy behaviors. So as counselors, we want to balance realism with hope. We want the clients to understand the seriousness of the condition, but also we want them to believe that change is possible. And that balance is what's going to keep them engaged in treatment. So I want you to pause here and I want you to think about your own experience working with clients. Consider the biological factors that we've talked about. Have you noticed that there's patterns related to family history or maybe tolerance or dependence or withdrawal? Think about the specific clients if you can. What did their biological factors look like? How did those factors influence their behavior? This reflection is really important because it's going to help you connect the theory to the practice. It's one thing to learn about these concepts in a course, but it's another thing to recognize them in real life. So I want you to think about, how did you respond to the clients at that time? Did you consider the biological component, or were you more focused on the behavior? There's no judgment here. This is just about awareness and growth. The more you're reflecting on your experiences, the more you're going to be able to apply what you're learning moving forward. So take a few moments, pause the video, really think this through here. Now we're moving into the psychological component. And this is where a lot of your direct counseling work is happening. These psychological factors are going to be the client's thoughts, their emotions, their beliefs, what are their coping mechanisms. These are all internal experiences that are influencing behavior. So while the biological factors may set the stage, the psychological factors are often going to determine how the person is responding to their experiences. So, for example, we may have two different people that are experiencing very similar stressors. They're maybe working at the same job, or they're dealing with the same situation, but their responses can be really different depending on what kind of coping skills do they have and what are their thought patterns. Yesterday I had gone to McDonald's and the Coke machine was down, and I had already paid, and I went to the second window and the girl was standing there. And so this is just kind of a difference in thought patterns. So she's holding the cup and she's saying, we don't have any more carbonation, and so I can't give you the drink. Do you want something else? And I said, no, I don't want anything else. And so at this juncture, my thought process was, she's going to go get a refund for me. Her thought process was, I can give you a cup of ice so you can go to the store and buy a Coke and put it in there. And so we had two totally different thought processes, and it created a conflict because she didn't understand that I wanted a refund, and I didn't understand her thought process. And so these thought processes are going to be very, very different depending on their cultural background, what they've been through in life, what they've experienced, what coping skills do they have, what are their thought patterns. And this is why the psychological factors are so important. And they are also areas where change is very possible. The clients can learn new skills. They can learn how to challenge those unhelpful beliefs, and they can develop healthier ways of managing their emotions. So as counselors, this is where we're spending a lot of our time. We are helping our clients understand their internal world and make changes that are supporting their recovery. And I tell my clients all the time, this is the best gift that I can give to you, is how to train your brain to think differently. It's really important to remember these factors do not exist in isolation. They're influenced by the biology. They're influenced by the environment. So we have to understand that connection is going to help you take a more integrated approach. Every time I think about this, I think about people from Jamaica. It's part of their religion is smoking marijuana. It's a religious, spiritual experience for them. And here in America, we don't see it that way. It's like, oh, you're just doing that to get high. And even more so, now we have this other shift of, oh, you may be using that for medicinal reasons. And So all of these things are going to kind of play a key role in, how we as clinicians are thinking about it, but also how the clients are thinking about it. And so, did they grow up with this? Is this a biological thing? Is this an environmental or a social factor? Is this a psychological factor based on how they're thinking about it? So we have to integrate all of those together. Trauma, this is one of the most significant psychological factors in addiction because a lot of people with substance use disorders have experienced some form of trauma, whether it's childhood abuse or neglect or violence or other adverse experiences, abandonment, whatever. Trauma affects how a person sees themselves. It's also going to affect how they see other people and the world around them. And it's going to lead to feelings of fear or shame, anger, maybe hopelessness, helplessness. And substances can become a way to cope with these overwhelming emotions. We know that two things to be true, that substances do a really good job of getting rid of the emotional pain. Emotional pain is going to be there, and substances do a really good job of getting rid of it. And it's a way for them to cope with those overwhelming emotions. And so we call this self-medicating. While it may create additional problems, it does provide a temporary relief. It's not really addressing the underlying issue. So as counselors, we have to approach trauma with sensitivity and care. Not every client's going to be ready to discuss their trauma, and that's okay. We don't need them to tell us what happened. Your role is to create a safe and supportive environment where they can explore their issues at their own pace. So you may want to be aware of how trauma can influence the behavior. And a lot of times I really focus on the here and now. How is it influencing my behaviors in this moment, like today? Like, what symptoms am I having? Am I being hypervigilant? Am I being avoidant or overly cautious? So I want you to think about what may look like resistance or avoidance may actually be a protective response to somebody who's experienced trauma. And understanding that's going to help you respond more effectively and avoid re-traumatizing the client. So mental health and substance use are closely connected, and it's really common for clients to experience both of those at the same time. And this is often referred to as co-occurring disorders. Conditions like anxiety and depression, they're going to increase the risk of substance use. And substance use also worsens the mental health symptoms. And it creates this really vicious cycle that's really hard for the client to break. So, for example, somebody with anxiety may use alcohol to calm their nerves, but over time, that alcohol use is going to increase the anxiety levels. So as counselors, we have to assess for both the substance use and the mental health concerns. Treating one without addressing the other is going to limit the effectiveness. This is why integrated treatment is so important. You want to help the clients develop healthier ways of managing their mental health, while at the same time, we also need to address their substance use. So that's going to involve teaching coping skills and providing psychoeducation. And we also need to coordinate with other professionals when we see that is necessary. Understanding that connection between the mental health and the addiction is going to allow you to provide more comprehensive care for the client. So coping skills, these are the strategies that people use to manage stress. They're managing their emotions, their life challenges, whatever. And so some of these coping skills are healthy, they're effective, and some of them aren't. So substance use is often a very unhealthy coping mechanism that's providing the temporary relief, but is creating long-term problems. I will constantly remind my clients that your substance use is a coping skill that you're using. It's not this thing that happened to you. I mean, it does happen, but it's a coping skill that you picked up along the way and you have now reinforced. And so if we can replace that with new coping skills, then, you know, eventually that particular coping skill doesn't become so prominent. But a lot of our clients haven't really developed healthy coping skills, especially if they grew up in environments where those skills were not modeled. So they never were taught anything else. And that's where counseling is going to play a key role. We're helping our clients learn and practice new ways of coping. And maybe you're teaching like techniques like deep breathing or problem solving. Maybe you're teaching communication skills or teaching them how to engage in healthy activities. So it's going to be important to remember that learning these new coping skills is going to take time. You know, I've literally played a video of my son at the beginning of his 6th grade year when he was learning how to play the saxophone, and I let them listen to how awful it sounded. And then I play the video from the end of his middle school years of learning how to play over 3 years, and they can see the difference, they can hear the difference. It's like a huge difference in his ability to play that instrument because he practiced every single day, you know, on how to play that. And so it's the same thing with these coping skills. You know, if you're wanting to learn how to play basketball and dribble the ball, you're going to have to practice in order to get it right. And so a lot of times what we see is clients may initially return to familiar patterns because they feel more comfortable. And I use the example of a trash can. So if I have my trash can on the right side of my desk, and then I move the trash can to the left side of the desk, every time I go to throw trash away, my first instinct is to go move to where the trash can used to be on the right side of the desk. And I'm going to do that so many times, 10 times, 12 times, 15 times, before I finally get it and remember that it's on the left-hand side of the desk. So your role here is to support your clients through that process and reinforce those new behaviors. And just remind them, you know, it is going to take you time. And over time, these skills become more natural, they become more effective, and this is a very critical part of recovery. A client's beliefs and their thinking patterns are going to play a really powerful role in addiction. And this is an area where counselors can make a significant impact because a lot of people develop patterns of thinking that support continued substance use. And that may be something like cognitive distortions, like maybe they're minimizing the consequences or they're blaming other people, or I believe I don't have any control over this or whatever. Justification is another common pattern. The clients may tell themselves that their use is acceptable because of stress or past experiences. Denial shows up in subtle ways too, like downplaying the severity of the problem. And these thought patterns, they're not random. They do serve a purpose because it's reducing that internal conflict and it's allowing the behavior to continue. So as counselors, we want to help the clients become aware of these patterns and challenge them in a supportive way. This is where cognitive behavioral approaches can be very effective by changing how the clients are thinking or influencing how they're behaving. And that's a really powerful tool in treatment. So emotional regulation, this refers to the ability to manage and respond to emotions in a healthy way. And a lot of people with substance use disorders, they struggle with emotional regulation. They maybe experience emotions that feel overwhelming and difficult to control, and the substances become a way to avoid or numb those feelings. And over time, that's going to prevent the development of healthy emotional regulation skills. So as counselors, we help the clients to learn how to experience and manage emotions without relying on the substances. So maybe this involves helping clients identify triggers and patterns. So emotional regulation, this is not about eliminating emotions. It's about learning how to respond to them in a way that supports their well-being. And that's a critical skill for long-term recovery. Psychological factors are central to the addiction process because they directly influence the behavior. Thoughts, emotions, coping skills, they're all playing a role in how people respond to their experiences. And the good news here is that these are areas where change is possible. Our clients can learn new skills. They can develop healthier thought patterns. They can improve their emotional regulation. And this is where counseling has a significant impact because focusing on these areas is going to help us to help our clients, make these meaningful changes that are supporting their recovery. It's important to approach this work with patience and consistency. Change isn't going to happen overnight, but with time and effort, it is possible. So I want you to take a moment to reflect on the psychological factors that we talked about. What stands out to you in your work with your clients? What are some of those common patterns that you've seen related to maybe thoughts and emotions and coping? There's got to be some sort of patterns across there. How do those factors influence behavior? This reflection is going to help you to apply what you've learned and deepen your understanding. So take your time with it. Pause the video, think about how have those factors influenced my clients' behaviors? What are some of the patterns that I've seen related to my clients' thoughts, emotions, or coping skills? All right, let's slow down here and really unpack the role of environment because this is one of the most underestimated factors in addiction. When we talk about environment, we are talking about everything that's surrounding the client on a daily basis. This is going to include where they live, who they're interacting with, what they're supposed to do, and what is considered normal in their surroundings. One of the most obvious environmental factors is access. I preach this to my clients. If I have access to something, if it's readily available, the likelihood of me doing it is going to increase. So this could look like living in a neighborhood where drugs are easily accessible, or maybe they work in an environment where alcohol use is normalized. I have clients that have said, I get off work and there's people out in the parking lot and they're smoking weed or they're drinking in their cars, and it is absolutely normalized. Or I have other clients who travel for work and their crew that they're with, they go out to eat and they drink consistently, like every night. So they're normalizing that use. Another thing is maybe it looks like having substances readily available in the home. Maybe their partner or their roommate are using. But access is only one piece. Stress is another major environmental factor. That chronic stress, whether it's from financial struggles or unsafe living conditions or maybe unstable housing or ongoing conflict, that can significantly increase the risk of substance use. The brain, it's already wired to seek relief, so it may turn to substances as a coping mechanism. And then we have the community norms, what's considered normal in a person's environment. And unfortunately, we have, as a society, normalized the use of alcohol in social situations or substance use in social situations. And I'll ask my clients frequently, when you go to a party, what are you expected to bring? And, overwhelmingly the answer is alcohol or some sort of like drugs or party favors or something like that. And so if heavy drinking or drug use is seen acceptable or even expected in their friend group or their family, it becomes a lot harder for that person to see their behavior as problematic because everybody else is doing it, right? So as counselors, we have to look beyond the individual and really assess the environment that that person's in. We can have the best treatment plan in the world, but if that client returns to an environment that's consistently reinforcing substance use, their risk of relapse is going to remain high. And so this is why environmental changes, when possible, can be so powerful. And when change is not possible, we have to focus on helping the client build strategies to navigate that environment more safely. Socioeconomic factors are often talked about, but they're not always explored deeply enough in clinical work. These factors are going to include things like income, employment, education, access to healthcare, just broader systemic issues. And financial stress alone can be just a significant driver of substance use. And when somebody's consistently worried about paying their bills or providing for their family or just simply surviving from day to day, that stress can be overwhelming. And so substances may be used as a temporary escape from that pressure. It's interesting because there's a research study that showed that the higher the income level, the less likely a person was to use marijuana. It was like 11% of those earning over $99,000 a year were substance users. And I think the number just decreased with the income bracket. And so the lowest income bracket had the highest level of substance use. And I think this is just goes to show that, they see it as a temporary escape from that financial pressure. But it really does go beyond stress. Limited access to care is another major issue. Some people don't have access to quality treatment or mental health services or even just basic health care. I currently live in a place where it takes an hour to get to the just basic doctor's appointments for my kids or for myself. That can delay intervention and it makes problems worse over time. So employment challenges, that's also going to play a role. Unemployment or unstable work can lead to increased stress and decreased structure. And it's just going to increase this sense of hopelessness. And then on the other hand, certain jobs may normalize substance use or expose people to high risk environments. I have a lot of clients that work in bars. We also have systemic barriers, like things like discrimination or lack of resources in certain communities and unequal access to opportunities. These are not always things that the client can control, but they do have a real impact on behavior. So as counselors, we have to be aware of these factors and avoid placing all the responsibility on the person without acknowledging the broader context. It doesn't remove accountability, but it does create a more balanced and realistic understanding. And it's going to help us advocate for our clients more effectively when it's needed. So let's take a moment to bring the social component together in a way that you can actually use in your clinical work. Social factors are not just background information. They actively shape behavior in meaningful ways. So every client that you work with exists within a social context, and that context can either increase the risk or provide protection. So it's rarely just one or the other. A lot of clients are going to experience a mix of both. So for example, maybe a client may have a supportive family, but they live in a high risk environment. Or they have access to resources, but they struggle with the negative peer influences. That's why we can't make assumptions based on just one factor alone. We have to look at the full picture here. Another important point is that social factors can change over time. So a client's environment, their relationship, and their resources are not fixed. Right? They can change. So that means that part of treatment can involve helping the clients to make those changes in those areas when it's possible. Maybe that might include something like building healthier relationships or finding safer environments or maybe access to additional resources. Even small changes can have a really significant impact over time. So as counselors, we need to pay close attention to what these factors are during assessment and throughout treatment. They're not just part of the intake process. They're ongoing considerations that should influence how we are approaching the care. And when you fully understand a client's social context, your interventions become a lot more targeted and more effective. So I want you to pause here and really think about the clients that you're working with. Consider their environment, their relationships, what are their access to resources, what external factors are influencing their behaviors right now. And I want you to try to be as specific as possible. Are they living in a high stress environment? Are they surrounded by people who are using substances? Do they have access to support, or are they just largely on their own? Then I want you to take it a step further and identify both risk factors and protective factors. That's going to be important because it's going to help you to avoid seeing the situation as entirely negative or entirely positive. Because a lot of clients have both negative and positive, right? So the risk factors and the protective factors. Like, for example, a client may have a high risk peer group, but they also have a supportive family member. And that family member can become a key part of the treatment plan. So this reflection is about building awareness. The more clearly that you can see these factors, the better you can respond to them. And it's going to help you to move away from frustration and toward strategy. So instead of thinking, why aren't they doing better? We start thinking, what's working against them and what can we strengthen? So just take a few moments, pause the video, and really just write this out. This isn't just an exercise. This is something you can directly apply in your sessions. All right, so now let's bring everything together, because this is where the biopsychosocial model becomes truly useful. I want you to think of a specific client, either current or past client, and I want you to picture them clearly in your head. Now, I want you to start by identifying their biological factors. Do they have a family history of substance use? Are there any signs of tolerance or dependence going on? Are there any medical or neurological considerations? Then I want you to move into the psychological factors. What are their thought patterns like? How are they handling their emotions? Does this person have a history of trauma? And what kind of coping skills are they relying on? Then I want you to look at the social factors. What's their environment like? Who are they surrounded themselves by? What kind of resources do they have access to? And once you've identified these areas, the most important step here is to look at how are each of these things interacting. That's where the real understanding is happening. So, for example, maybe a client has a genetic vulnerability. They're experiencing high levels of stress. Maybe they have a lack of healthy coping skills. And those factors together create a much higher risk than any one factor alone. And that's where your treatment planning becomes a little bit more precise. So instead of using a one-size-fits-all approach, we're targeting the specific factors that are most relevant for that client. And so this exercise is something that you should be doing regularly in your work. It's strengthening your critical thinking, and it's helping you to provide more effective care for your clients. So as we're wrapping up this lesson, I want you to really hold on to a few key ideas here. First, addiction doesn't have a single cause. There's no one explanation that's fitting every single client. Instead, it's the result of multiple factors interacting with each other over time. And then second, these factors are not static, right? They're going to change and evolve and influence each other in different ways depending on the situation. So this means that your understanding of a client should also evolve over time. What you identify at intake may not be the full picture. So ongoing assessment is critical. And then third, comprehensive treatment is going to be essential. If we focus only on one area, we're likely to miss important pieces of the problem. Effective treatment addresses biological, psychological, and social factors in a very balanced way. And that doesn't mean that you have to do everything yourself, but it does mean that you need to be aware of these areas and incorporate them into your work. And then I want you to think about how this lesson has shifted your perspective. Do you feel like you're more equipped to understand your clients? Do you feel more confident in your ability to assess and plan treatment? These are the outcomes that we're aiming for. It's not just about knowledge, it's about improving your practice. So for your assignment, I want you to take everything that you learned in this lesson and apply it in a very practical way. Just choose one client that you're currently working with or that you've worked with in the past and start by identifying at least 2 biological factors, 2 psychological factors, and 2 social factors that are relevant to that client. I want you to be specific. Avoid any general statements and think about what is actually influencing their behavior. And then next, I want you to describe how those factors are interacting. That's the most important part of the assignment. It's not just enough to list the factors. We need to understand how they're working together. So for example, how does stress interact with the coping skills? How does the family history interact with their current environment? And once you've done that, I want you to identify one change that you would make in your treatment approach based on that analysis. It could be something that you would add or something you might adjust or something that you might approach differently. So the goal of this assignment is to move from understanding to application. This is where the real growth is happening. So take your time with this. The more thoughtful that you are, the more valuable it's going to be toward your practice.